Okay, guys, now I've got discussion C for you, but today's discussion C goes through assisted living for substance use disorder in the elderly. So that is what today's C is going to be about. So please join me in today's discussion C. Here we go. Overview. People with substance use disorders can live safely and process in recovery in several assisted living style settings that combine housing, daily supports, and addiction specific services. These options range from licensed residential treatment with medical care to peer run recovery residences and assisted living communities that offer on site or coordinated addiction support. Main, main types of assisted living and residential recovery options: residential treatment, medical clinic, short term, short to medium term programs providing 24/7 clinical care, medically supervised detox when needed, individuals and group therapy, and discharge planning, sober living, recovery residences, peer supported, peer governed homes, emphasizing sobriety, routine, and mutual accountability with varying levels of structure and house rules. Transitional supportive housing, time limited housing that pairs case management, employment help, and relapse prevention with stable housing. While people step down from intensive treatment, assisted living with behavioral health coordination, licensed assisted living communities that coordinate behavioral health services, medication management, and outside addiction treatment for residents who need help with daily living plus recovery support. Dual diagnosis residential programs, facilities that treat co occurring mental health and substance use conditions with integrated care plans and psychiatric supports, respite and short term respite stays. Give me 1 second, guys. Short term assisted living stays to stabilize a person's person in early recovery, provide rest, and connect them to ongoing services. How to choose the right option. Practical criteria. Clinical need. Prioritize medical detox and residential treatment if the person has psychological dependency dependence on active withdrawal. Level of supervision. Choose 24/7 clinical staffing for high risk individuals. Choose sober living for motivated residents who need peer structure. Integrated mental health care. Pick programs that treat co-occurring disorders if psychiatric symptoms exist. Medication management. Confirm whether the program supports medications for opioid or alcohol use disorder, e.g., norepinephrine, methadone, uh, no, no, Texone, licensure and accreditation verify. State licensure CARF or JCAHO accreditation or membership in reliable recovery residences networks. Staff training and recovery philosophies. Review staff. Credentials. Trauma informed practices, cultural responsiveness, and whether they use evidence based therapies, aftercare, and discharge planning. Ensure clear pathways to ongoing outpatient care, peer supports, employment help, and stable housing. Cost and payer options. Check Medicare, Medicaid coverage, state block grants, private insurance, sliding scale fees, and local grants. Family involvement and visiting policies. Confirm rules for family engagement and transition planning. Local context and options. There are multiple assisted living communities and supportive housing options serving PA and the surrounding area. Regional directories list about a dozen assisted living providers in and near Pennsylvania. Caring.com, senioradvice.com. Okay, then there's Juniper Village at Meadville is an example of a local assisted living community that offers personal care, respite stays, and coordinated medical services. Families commonly use such communities for stability while arranging addiction specific outpatient care. For example, for clinical residential treatment, detox, or specialized dual diagnosis care, people in Pennsylvania commonly coordinate with nearby hospitals and regional treatment centers and use case management to bridge to local assisted living or recovery residences. senioradvice.com. Recommended next steps: assess immediate clinical risk, arrange medical evaluation if withdrawal, overdose risk, or unstable psychiatric symptoms are present. Identify the need for level care. Use the clinical assessment to decide. Between medical detox, residential treatment, or supported assisted living residence placement. Call local directories and facilities. Contact area assisted living communities and recovery residences to ask about behavioral health coordination, medication policies, staffing, and availability. Confirm payment and coverage. Ask facilities about Medicaid, Medicare, insurance authorization, sliding scales, and local behavioral health funding. Give me 1 second, guys. Plan aftercare. Secure outpatient counseling, peer support, meetings, and case manager before move into reduced relapse risk. Document preferences and supports. Prepare a concise summary of medical history, medications, relapse triggers, and emergency contacts to share with any prospective residents. Quick resources to contact locally. Local assisted living directories and listings. Facility lists, prices, and reviews are available through regional sites that integrates assisted living providers. Contact Juniper Village, Meadville, for details about their personal care and respite services, and ask how they coordinate external addiction treatment service.